Thank you for being here. I'm going to show you some case presentations based upon a model that we've developed over the past years. And I want you to sit back and just try to take in, it's a volume of information, but it is in the CD and the slides that you have. Carl Sagan said that science requires a strange mating of two contradictory tendencies, a willingness to consider even the most bizarre ideas, and at the same time, a harsh skepticism requiring hard evidence to back up every claim. Obviously, that's why we here are in the audience, and as we try to figure out how to beat silent inflammation, that's the underlying cause of disease, we realize that if we were to live to age 60, maybe this would not be such an issue. But since we are living beyond that, it becomes imperative that we figure out what is the science of anti-aging, functional medicine, regenerative, restorative, living better, any age. We have patients in our practice all the way from age 1 to age 89. In this medical model, I want to share with you that we use to restore optimal function, optimizing the hormones, the nutrients, detoxifying the body, restoring mind balance, restoring body balance. I say it works because I'm going to show you some case presentations. The data upon which this model is based does not come from resources such as this or from resources such as this medicine woman in Brazil who I had the pleasure of working with, but it actually comes from the body of literature that we have accessible to us in the general literature. It's a 5-point model, and it was very easy for me to step into hormones from my background as an obstetrician and gynecologist when I first started into this scenario. But what I realized is that without looking at the nutrients that are responsible for activating those hormones, and without looking at the liver, the bowel, and the pH of the tissues that's responsible for allowing the reactions to take place in the first place, and then we had to pay attention to the stresses in the mind and the stresses in the body. So this is the 5-point model I'm going to share with you. I guess this must be the pointer. Yes, okay. When you look at the hormones, with each passing years, from the age 25 onwards, and actually what we're finding is in cases of high stress and low nutrition, this may even occur before that, but in both men and women, hormones start to change quite a bit in the 20s. Some hormones go up, some hormones go down. And in women, progesterone is probably the first noticeable hormone to go. Somewhere in the mid-30s, women will start to report lighter sleep, anxiety and panic attacks, mood swings and irritability. This is the #1 cause for a Prozac prescription. Breast cysts, ovarian cysts, fibroids, and heavy bleeding. It's the #1 cause for a hysterectomy. Progesterone is responsible for the anti-proliferative effect on all of these organs, so as it declines, we get all these growths. We have worse PMS, mid-abdominal weight gain, low sex drive, hot flashes, and also because progesterone happens to be a very strong osteoblastic stimulator, as it goes down, we start to lose bone. That means we start to lose bone somewhere in the mid-30s and not in the 50s when we start looking for that bone loss. Women don't acquire Xanax and Prozac deficiencies when they reach the late 30s. Men don't acquire Viagra deficiencies. The receptors for estrogen, progesterone, and testosterone are present in every single organ in the body, on all the brain cells, all of the heart cells, the muscles, kidneys, skin, hair follicles. So obviously no wonder that as the hormone levels decline, not only do you see a host of symptoms such as hot flashes and vaginal atrophy and urinary incontinence and lower energy, but you also start to see the degenerative diseases that are associated with decline of the organs that the hormones support. This occurs in both men and in women. Men noticing more anxiety and depression, loss of sexual function, loss of muscle mass. So when you ask yourself the questions of whether or not it's safe to replace hormones, also ask yourself the question as to whether or not it's safe to not replace them. The menopause maze, if we look at our standard in medicine, the standard in medicine is to replace whatever is missing with what is missing. So when I say that we shouldn't be without hormones, obviously the big question that comes up, and especially in women with the Big Women's Initiative study that was published in 2002, is whether or not this is safe. Does it cause cancer? Does it cause heart attacks? I want to summarize the findings from the Women's Health Initiative because they were so important to our understanding of how to protect women. One of the very first findings, and as you must know, this was 16,000 women using conjugated equine estrogen and medroxyprogesterone acetate. And over the years, I would say this is probably one of the most analyzed studies that I've seen, at least over the last 10 years. And there were some reasons why they had increased risks. One of them was because of pre-existing disease, and I don't know if any of you are familiar that over this past year they actually published a reanalysis showing that the women who were on hormones actually had a 30% decline in all-cause mortality, whether they got diseases or not. So that's kind of an important finding that wasn't in the media. Next thing is the oral route. And obviously we know that when hormones go through the oral route, it stimulates the liver to produce clotting factors which increase the incidence of strokes and heart attacks. We now have at least 36 studies that are in the cardiac literature showing that when you use transdermal estrogens and either through patches or creams, you actually lower the incidence of clotting mechanisms, lower the risk of a heart attack and a stroke. Also the ratios. We know that there's about 18 to 20 different estrogens. Some of them go up, some of them go down. The ones that protect us tend to go down over time, and the ones that are risky for us tend to go up, like estrone, which was the estrogen used in the WHI study. The last finding is that there's at least 5 separate trials showing that if you use progestin, form of progesterone, you increase the clotting risk, strokes, heart attacks, and breast cancer somewhere between 2 and 8-fold. So these are the findings, in fact, that created a situation where the North American Menopausal Society changed their position on hormone therapy almost every single year until 2008, when they finally said recent data support the initiation and the benefit to risk ratio is favorable. Just to point out, when I'm using hormones, the over-the-counter products are generally not identical to the human body. If you look at the lower picture, which shows an estrogen from soy, you can clearly see that it has some extra groups and a ketone group compared to 17-beta estradiol, which is the upper picture, which is human identical. There are several FDA-approved patented formulas that are completely bioidenticals, and they have gone through rigorous studies before they were approved by the FDA, and I use them liberally. So obviously we've learned that we don't treat people in the upper age groups with those kind of hormones. Now, I don't want to tell you that you can't use bioidentical transdermals, because I use them all the time in that group. Always use the transdermals and bioidentical progesterone. Hormone-wise, I can't get into all of the different hormones, but one of the things I can tell you, I wonder how this thing goes backwards, but 3 other hormones that become very relevant are thyroid, insulin, and cortisol, because those are the metabolic hormones which change even from the teenage years onwards. Every single time we have stress and cortisol goes up, the thyroid subsequently goes down. Up to the age of 40, when the stress goes away, the thyroid comes back. But after the age of 40, our recovery of that organ is a little bit lower.